Okay, here we're working on hip flexion, so we see the knee coming towards our chest. Here we want to make sure that we're not getting a ton of pelvis tilt during this. We want to make sure all that motion is coming right from the hip joint. And you can see that I did it actively first, where I'm just bringing that knee as close to my chest as I can, and then I will do some passive overpressure where I'll actually pull the knee even closer. And we're looking to get at least 120 degrees of hip flexion here. So now my left side, I'm bringing that up. I'm going slow and making sure the knee doesn't go out or in. Should be stay straight in line towards my chest, and seeing how far I can actively do it myself. And then I will use my hands to see how much further I can get it passively just by pulling on it to see what that max range of motion is there at that joint. And then from the side, similar. See, not letting this leg come off the ground and not letting this pelvis dump or my low back come off the ground. Aiming for 120 degrees. This being 90, I'm getting just past it towards that 110, 120 degrees, especially when I use some passive overpressure.
Okay, so it's really important that we have good hip mobility when we're exercising. We need to make sure we have good internal and external rotation at the hip. So this is how we can test for it at home. We'll be doing an active version of the test where we're laid down on a mat. We'll have our legs out straight, and then we'll bring one up to 90 degrees of hip flexion, 90 degrees of knee flexion. And then from here, I want you to think about keeping this knee directly in line with this hip. Don't let it come out to the side or in. And then to test internal rotation, we're going to rotate our femur in, which is going to cause our foot to rotate out towards the side. Okay? And we're looking for about 30 degrees of internal rotation. So I'm lacking a little bit here on the right. Now, when we test external rotation, we do the exact opposite. Our knee stays in line, but now our foot is coming in. And make sure we don't get too much motion here at the pelvis at all. We don't want any fake ranges of motion. Do the same thing on the other side. Internal rotation. External rotation here, internal rotation. And again, lacking on this left side as well. Now, if you're with a therapist or chiropractor, we would now passively test, and where we would take you into that range of motion and see the differences between active and passive range of motion.